So today marks 361 days since our first case of COVID-19, 4 days away from our 1 year anniversary, not an anniversary that I take pleasure in celebrating or that we're in, but it's here, 52 weeks, hard to believe. Today is also International Women's Day, a time to reflect on the incredible contributions women have made to our society and to remember to fight for full equity continues. I also want to recognize all our female department heads in Albany County, ensuring that they carry out some of the most difficult duties and responsibilities in all the departments they oversee. Department of Children, Youth, and Families, Public Works Department, Dr. Whalen, of course, her Department of Health, Alternate Public Defender's Office, Social Services, Immigration Center, our DPW, and a lot others. So I want to say thank you to all their leadership, and can't get through this without all of them. But sadly, today, we have another person that passed away from COVID-19, a man in his 90s. My thoughts and prayers go out to the family, to all the families that go through these difficult times of losing a loved one. It's hard enough to lose someone you love. It's even harder in these tougher times to say goodbye properly. And I said this before, there's a lot of families that are choosing to have private services, and they're going to do memorial services when things open up so they can invite all their friends and families. Steve, you lost your mom through these difficult times, and it was a beautiful service and tribute to her life. And again, we're capacity, what the church could fill. I could only imagine what it was going to be like if we were open. And it's hard. It's hard to say goodbye to people. So please keep that in mind, and keep it in mind for all the 361 people we lost in this county in the last 12 months. As of today, we have 20,973 cases of COVID-19 in Albany County to date. 56 positive cases since yesterday, 63 new positive cases on Saturday, and there were 68 the other day. A 5-day average of new daily positives is now 64.6. Yesterday it was 65.2. That's currently 1,453 people that are under mandatory quarantine. Yesterday that was 1,484. We have 21 that have close contacts to a positive case, 1 healthcare worker, and 34 don't have a clear source of infection. So out of that, 20,433 people have tested positive for the virus and had recovered, which is good. And Dr. Whalen talked about it, and I talked about it on Friday's press conference, that some people recover with no problems, and then some have long-term effects going forward. That's an increase of 78 recoveries since yesterday, which is also good news. There were 2 new hospitalizations overnight. There are now 28 people currently in the hospital from the virus. Yesterday, that number was 35. This is the lowest number we've had since November 6th, which is good stuff. We're all going in the right direction. So thank you to everyone that continues to do the right thing, coughing into their arms, wearing their mask, staying 6 feet apart, and doing the right stuff. So thank you, thank you. The light's at the end of the tunnel. It's not time to get COVID-19 fatigue. Continue to be strong so we can continue to get through this. As I keep reminding everything, COVID isn't done with us, so please stay vigilant. Please stay vigilant. I also want to say people that want to get vaccinated, please go to the state website. Their hotline's 1-833-697-4829. The United Way, as always, 211. Thank you for their partnership. And talking about partnerships, I do want to say our pre-registration has been a huge success. I said it on Friday. There are some bumps in the roads with any new data that you put in there. And the fact that we had over 30,000 people register on our pre-registration site kind of set us back a little bit. Over 11,000 in the city of Albany. The rest was in the county. Some people from outside the county. But we said we'd get to you. And I want to say to the Alliance for Better Health and Juliet, thank you. I spent the whole weekend watching her in action. That pre-registration, I think we'll have Juliet here on Friday to talk about it, was a home run. And I think we exhausted that whole list, which is awesome news. And people that had appointments out in Utica or Potsdam or Plattsburgh or downstate got an opportunity to get their shots here. The many stories was successful. So again, please, I'm encouraging people that are watching this, and we'll put it out, pre-register. We need to get them pre-registration numbers back up there, and everyone that's exhausting from it. And one of the things we took away from the great job that the health department's doing and everyone else in the partnership, and I'll get into it, to all of our different partners, is that I can almost say we probably exhausted all the 65 and older, and it's time to open it up, bringing that number down to 60 over, 55 and over, and continue to get people with underlying health issues. We still continue to get teachers and everything else, but it's time to open it up, which is a good thing. That's what we've been waiting for. You know, it's a good situation to be in. I talked to other counties that were having the same issue trying to track people down 65 and older, because either A, they got it, or they got a reservation somewhere at the Army. I know people are getting some in April, some are just waiting to Albany, you know, down the road, which is good too. So please continue to do the pre-registration. Go to our Albany County website, albanycounty.com. You can use the red bar across the top, which will take you to the COVID page for the pre-registration, and also bring you there to the people that we're in partnerships with, like the variety of organizations around the county that are doing COVID-19 testing still, eligibility, what age groups of kids that can get tested and so forth. If you need a PCR test to get back to school, there's wait times and all that. So please go out and get tested and do the right thing. But as of yesterday, we've hit 23% of Albany County population that has received at least one dose of the vaccine. That's still the second highest in the capital region. Warren County, you're beating us again by 24.8%, but we're gonna get you, Warren County, at the end of the week, right, Dr. Well?
Hopefully.
Hopefully, we're gonna overtake Warren County. I hope. We administered at the TU on Saturday, on Friday, it was Saturday, yeah. 1,733 first doses for older residents, and we had the clinic at Watervliet and Knox and in West Albany, American Legion Post in North Albany, and Watervliet Senior Center. So all huge success and partnership. Thank you to Dr. Whalen and team coordinating, but thank you to everyone in the volunteers, because there's so many volunteers, I couldn't list them. I'd overlook them, and I want to say to the people who have not been thanked from us, thank you for what you do, because it's not possible without the volunteers. It's not possible with the people in the community that come out and help out. To everyone that's involved, and to Mohawk Ambulance, thank you for the great partnership as we continue to move forward. So just to give you an idea of what vaccine we've been putting out since the beginning, 15,300 first doses of vaccine went out, 4,620 second dose. So we have a total of 19,920 doses that have been administered, not directly by our health department, but in partnerships with St. Peter's Health, Center for Disabled, Mohawk Ambulance. Because again, this is what I said, it's about the partnerships, it's about working together for the people. So to my office staff and to everyone that's been coordinating this, and to Mayor Sheen and her team that have been helping us in the city, and to I said it's the legislators, can't thank them enough, the common council members, and Joyce Love, and Corey Ellis, the president. And again, it's just, we're all working together, and that's what we need to tackle this, and this is what this community deserves: leadership, working together in a partnership, getting the job done. So again, thank you. And then to Alliance of Better Health, thank you so much. So I just want to remind everyone, on top of that, Sunday afternoon we did 400 vaccines at the Watervliet Senior Center, which turned out to be a huge success. So to the whole team there, thank you. And it was great seeing everyone. But please, pre-register, use the tool. I'm going to ship this through our control room to General Murphy. So General Murphy, if you're watching this, state should do the same thing with the pre-registration to help people navigate. Because if they have an appointment out in Utica, you can free that spot for a resident in Utica. You can free that spot at the Kingston Armory or Lexington or Queens Armory, or wherever, Bronx or Jamaica Army that they're working out of, or the Java Center. It helps stop people from traveling around the state, and it helps people just ease that anxiety, because if I heard from everyone, it was just the fact that the anxiety of trying to get the shot. It wasn't so much. I do want to say this before I turn over to Dr. Whalen. Please, if you listen to Dr. Fauci, if you're offered the Johnson & Johnson or whatever the shot you're offered, take it. I had people walk away yesterday that said, "Oh, I'm going to wait for the Johnson & Johnson. It's only one shot, and that's what I want." We don't know when we're going to get it. We said we would take it. We don't know when we're going to get the Johnson & Johnson. And for people to walk away from a shot that they're waiting for because they want one shot, I get it. But Dr. Whalen can talk a lot better about this than I can. I know you got to wait 21 days for the Pfizer, and then you got Moderna, you got to wait 28 days. Okay, so what? You come back for a second shot. It's one step closer to getting to that 70%. It's one day closer to getting to the light at the end of the tunnel. It's one day closer to us just trying to get back to some norm, wherever that norm is going to be when this is over with. Dr. Whalen.
Good morning. So yes, last week we had a very successful week with getting vaccine out into the community, and we're able to run multiple pods and also work with partners to be able to reallocate vaccine across the community to get it out quickly. Our focus was particularly on the over 65s, but we also did vaccinate those with comorbidities and 1B essential workers. This week we had notification for our allocation, and it's an unusual week. It is going to be the first week that we have not yet received a Moderna supply of vaccine. We are receiving exclusively Pfizer. We are not receiving Johnson & Johnson. So we are committed not to do the same two different vaccines on the same day. So when I know more about when the Pfizer shipment is expected, we will be announcing a pod for later this week. And that will be focused on those with comorbidities and seniors as well. We're hoping to get an allocation for seniors. So getting this vaccine out continues to be our major focus. We do, however, continue to see cases across the county. We do, however, unfortunately, continue to see deaths. So we want to make sure that we are reiterating, as always, the message for people to continue the important public health practices to protect themselves and their loved ones. As the county executive just indicated, the vaccine that's right for you is the vaccine that is available for you. We are hoping to get some Johnson & Johnson in. I know a lot of people are interested in a single-dose vaccine without having to schedule a second vaccine. It's a little bit more convenient for people. And this vaccine is very effective against preventing hospitalizations and death, along the same lines for those two indicators of the other vaccines. So it is a great tool in our armamentarium, and we look forward to getting it out when we get a supply in. We will continue to get vaccine out as quickly as we can, and we look forward to all the developments going forward that will hopefully smooth this process for people. I understand there are still individuals that are having a difficulty signing up online. It is our hope that the work that is being done with Alliance will be able to create a system that's a little bit more user-friendly for people, and that the pre-registration list that we are currently working off will be able to streamline that process as well. In the interim, we have full clinics, and we are operating on full clinics to get vaccine out as much as possible. I also do want to recognize International Women's Day. At the health department, we are predominantly women working at the health department. We have many nurses and health professionals that work with us in a very dedicated way that have been working really long hours at great sacrifice for the past year. And I want to recognize those women in particular for the strong work that they have done. My Deputy Commissioner Mary Beth Miller, Assistant Commissioner for Finance Shanna Witherspoon, and all others that have been working through this entire pandemic. Tricia Bellato, I know I've mentioned several times, is our preparedness coordinator. Kathy D. Thomas is our nursing division director. Nursing Division Director, Liz Lewis, our epidemiologist. We have a really strong group of women, and I want to thank them for all the work that they've done. It's not lost on me when we talk about the populations that have been affected by the pandemic, that women have been affected in a way that is disproportionate to the effect on men. And I've often said in the last year, if this pandemic had occurred 10 years ago, when my kids were 6, 8, and 10, it is unlikely that I would have been able to do this job. I think that's a big statement. And that really speaks to how much support we need to give women in the workplace. And whether that's from a policy or legislative perspective, change needs to be made so that women can continue to work, so that women can continue to be productive in society and to have the support that they need through childcare. So I am going to make that plug. I think it's important from a policy perspective, and I would argue it's from a public health perspective as well. And finally, I want to thank my own mother, who is an incredibly strong person, Joanne Whalen. She was instrumental in getting me where I am. She also was blessed to be surrounded by strong women in her life. And I think it's important to note that one of those strong women was Virginia Aquario, who was a dear friend to my parents. They were St. Peter's nurses together, started off their careers together, and worked for many years. And Ginny was a strong woman in my life who I'm thankful for today, too.
Thank you, Dr. Whalen. And we had great news over the weekend, and it seems we've gotten closer over the years. When I was president of NISAC up until October, but we started down this path, Steve and I, with Matt Chase from NACO. I want to thank Matt especially, too, and Mike Griffin from County Executives of America. But 11 months ago, and it was almost a year, and we were fighting through April for the stimulus aid package, and we didn't give up. We continue to work on it. We continue to educate. But one of the bigger factors we had in our arsenal was Senator Schumer, who totally got it, understood what we needed, understood it had to come to the counties, to the towns and villages, not go through the state. So we ended up we'd have to plead with it to get our money that we're entitled to. But it took 11 months, and took a change in administration, took a change in the House, and we've gotten it. And I can't thank Senator Gillibrand and all the senators that voted for this. Thank you. What's it mean to us, this American Rescue Plan? $1,400 for each member of a household who one qualifies. Direct billions of dollars to schools, to states and local governments and businesses that who qualify. Single Americans who earn $75,000 or less. Single parents who earn $112,000 or less. Couples who earn $150,000 or less will receive a $1,400 check for each individual in the household. If you make more, you still may qualify, when this all comes out, but it won't be as much as the $1,400. The $160 billion to schools that are in desperate need of this because of the pandemic, because of everything going on, the way they had to reinvent the classrooms, the way they had to introduce technology, to the poor school districts that don't fairly get their aid, that don't have internet for the kids, didn't have laptops for the kids. Teachers had to learn how to educate via the internet, and all this happened. And there was a lot of stumbling, there was a lot of failures, but we've learned so much in this last year of how to go to remote, how to teach kids. Dr. Whalen brought up a great point. When I stayed home with my kids, I thought that was hard enough. I always say the hardest thing I did. I didn't have to teach them. And now parents that have to stay home and work, especially women that are working from home, being the teacher to their kids and still trying to do their job. I can't imagine the pressure they're under. It has to be tough enough, right? The state will receive its $23 billion, with $12.5 billion going towards their $15 billion deficit. And remember, the state had a $6.7 billion deficit before this started. MTA's like $12 billion. But this is the aid that we needed, because the governor said that if he didn't get to $12 billion, and I'll let Steve talk about it, then we would knock it down to 5%, I believe, that he was going to hold back from all state programs. So we did get notified. We are going to get back $2.3 million they've been sitting on until they knew what aid they were going to get. So these are all good things and good issues to have going forward. To the city of Albany, now it changed. The House bill was changed, and you can talk about this too. The House bill was different than the Senate. The Senate changed it, scaled it back. We were going to get $59 million. Now we're going to get $55 million. The Senate passed. The city of Albany was going to get $78 million. They were knocked down to $72 million. The town of Colony is going to get $7.5 million. The town of Bethlehem, $5.9 million. Town of Gilliland, over $6 million. New Scotland, over 1.5. Doug LaGrange, you can leave me alone. Supervisor from there keeps bugging me. Great guy though. In the Village of Green Island, like roughly $500,000. In Altamont's like 1.3. We put a letter out Friday. It's going to be adjusted, and we said that it may be adjusted as things. The House has to take it up now and just fix what the Senate changed. But all good things, and this is not possible with a lot of people. It took so many people, Steve, and I want you to talk about it because we spent all day Easter last year, sat with our families, and we were working on this from 7 in the morning until like midnight, trying to change it, have them understand why it should go through counties. Senator Schumer got it, but we had to convince people across not just the state of New York, but across this nation. But Steve Aquario, who runs NISAC for us, does a great job. Executive director extraordinaire, who has helped with not just with this, with PPE, the partnerships, the inner working between not just county executives. People got to remember there's 57 counties upstate. There's only a few county executives. A lot of them are run by county managers or by the supervisors of them respective counties, and we all been working together with a common goal to help all New Yorkers, to help us all. Doesn't matter who you are, what party affiliation. It was about getting the job done. Steve, you did that. Steve Aquario.
Thank you, County Executive, and thank you for your comments about my mother, Virginia Aquario, County Executive. I appreciate your compassion and concern on her health over the past year, and to Dr. Whalen for mentioning my mother as well, and the contribution she made to me, and the inspiration she made to me, and to inspire all sorts of women. She was a maternal child care educator, OB/GYN nurse, dedicated her career to helping others, and I miss you, Mom. County Executive mentioned the American Rescue Plan, or what I like to refer to as the Schumer Rescue Plan, because it took a New Yorker to get that bill across the finish line, and that New Yorker was the right person at the right time in the right chair, United States Senator Charles E. Schumer, delivering a financial package for America, for the states across the United States, and in particular for New York State. This is one of the most significant moments in our time, in our history, as the county executive and the Commissioner of Health of Albany County, Dr. Whalen, has gone through each and every week for the past 52 weeks and then some, educating and informing the public. This pandemic, our response to this pandemic, and now the recovery efforts of this pandemic. But thanks sincerely go to Senator Schumer. This package, as the county executive mentioned, will provide nearly $100 billion to the state of New York alone. To the families hit by the pandemic, to the workers, to the restaurants, to the small businesses, and to further assist Dr. Whalen in expanding the vaccine rollout. But it did take a New Yorker to make this happen. As the county executive mentioned, federal aid, $12.5 billion to the state of New York, $2.2 billion to the 57 counties, and nearly $1 billion to all the small cities, towns, and villages all across this state. Every county leader advocated for the passage of this federal assistance for counties and local governments. Both parties, upstate, downstate, urban, rural, they've all been impacted, and then they've all been working nonstop, as the county executive mentioned, for the last year to help protect the residents. Local governments need to use these funds to end the pandemic, help local businesses, support the families hit hardest by the crisis, and to rebuild our infrastructure. We all need to work together, counties, cities, towns, and villages, to use these funds in a way to strengthen our communities for the future. This is the first time the federal government has provided direct, unrestricted aid directly to the counties and the local governments of the United States. It's unprecedented that this occurred. And County Executive McCoy made this case 1 year ago, right in this room, where he championed this successful effort. Every day talking about the impact on the lives lost and the economic loss. He led the state of New York's efforts in Washington, D.C. He led the nation as the president of the County Executives of America. And as County Executive mentioned, the City of Albany receiving just shy of $80 million, the Town of Colony hovering around $8 million, City of Cohoes $3 million, City of Waterbury $1 million, Village and Town of Green Island around $400,000, and as the County Executive talks about frequently, the rural towns of Bern and Knox hovering around $400,000. That is unprecedented. The grand total for the County of Albany hovering just over $174 million. That's substantial, County Executive, and thank you for what you did to make this happen. This is about rebuilding our society post-COVID. It's about resetting, reemerging, re-engaging the needs of the community, our system of public health, and our economy. Just quickly, what have we learned at this point during this pandemic? We weren't prepared at this magnitude. We haven't invested properly in our local public health infrastructure. We need resources to better respond. We need a better system of command and control between the federal, state, and the county. We need a better system to procure personal protective equipment, contact tracing and quarantine, testing and vaccine administration. We learned the disproportionate impact in inequities in our healthcare system. And we learned that remote learning in our schools was indeed a challenge. I'd like to end by just simply commending the County Executive of Albany, Daniel McCoy, and acknowledge the attributes of his leadership style, his emergency management experience, his military training, his trust, his respect in the community, and his transparency with the public. Competence, sir, matters, and you have it. I'd like to acknowledge his calm demeanor, making daily decisions, partnering and working together with the people of this community. And I'd like to acknowledge Dr. Liza Whalen. Dr. Whalen's training, education, demeanor, and skills, making decisions using clinical and medical rationale. Dr. Whalen carefully weighs the risks, the benefits, and the alternatives to every decision that she makes for the County of Albany, knowing that the length of this pandemic would take. Both of these leaders use care, compassion, and concern in every detail of this response and this recovery, and it's a pleasure to be with you here again today. Thank you, County Executive.
Steve, thank you for the kind words, and it did take us all working together to get it done. But you are correct. It would not be possible without Senator Schumer in understanding that, and to have this directly come to us. You're right. It's never been done before in our nation's history. So thank you to the senator and every senator that voted on it. And you know, just to say, extra $4 billion is going towards to ramp up the vaccine and setting up vaccine centers across the state is awesome. $28.6 billion in aid to allocate for 6-month grant programs for restaurants hit hard, because we said this early on a year ago, and as this continued on, 50% of the restaurants in New York State are going to close and never come back. This is the difference of them staying open and moving forward. $10 billion for aid will be made available for smaller businesses, which is awesome because the senator heard us on that when the first PPE grant came out. It was all big companies that scarfed it up. The smaller businesses did not have an opportunity, and I'd like to thank the Albany County Legislature and a partnership to do smaller grants for smaller companies because they're just as important. They might not have the relationships with the banks, they might not have the accountants, but they have our good government here in Albany County to make sure that we take care of them. So again, I want to thank Senator Schumer and all the senators and Joe Brand and everyone else, because it wouldn't have happened without NACO, without your extraordinary, again, leadership at NISAC. Because I've seen, call me at all hours, going back and forth, being there for each other this last year. Not to sound corny, we used to agree to disagree on a lot of things, on different stuff, and this brought us a little bit closer. We had no choice, just to be honest with the folks out there. But Steve has a great way about him, working together with everybody. And Steve, I do want to say thank you.
Thank you, Ken.
So please, again, go to if you need to get tested, go to albanycounty.com to get tested. Our mental health's available 7 days a week. Please, I know things are different for everyone. That's why when I was talking to people who want to wait for the Johnson & Johnson, I was trying to explain to them, don't walk away from this. I wasn't going to argue with them. I just made my case. Every shot in anyone's arms is a shot closer to reopening. But again, they just want that one shot and walk away. don't walk away from opportunity, because I can assure you there's thousands of New Yorkers that are trying to get their first shot and that would have took that shot. We can reallocate it, we will, and we did. But again, it just makes it tougher. So please take the shot when you can, and don't wait for the one that you think's better than the next. But our mental health's available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. And please call 211 as always. And our 24-hour sexual assault hotline number, it's Karen Ziegler and her team. Thank you, 518-447-7716. And to everyone out there who continues to do the right thing, thank you. I know it's difficult. We'll get through this. We will continue to get through this. And the light's here, the end of the tunnel's here. Once we hit 70% of people being vaccinated, things will get easier. So, and as the rollout of more vaccine coming, I'm hoping that timetable, September, October, looks more like May and June.